Speaking at the press briefing at the Directorate of Health and Family Welfare Kohima on 23rd April 2020, Nagaland's Secretary Health and Family Welfare Kesonyu Yhome said that the COVID-19 crisis had brought to light gaps in the healthcare delivery system in the state, faced with infrastructural and human resource constraint. Despite this, it assured that the government is working towards confronting challenges and to ensure the safety of the citizens with strong support from all sections of the society.
COVID-19 crisis has brought to light gaps in the healthcare delivery systems in the state to meet such an eventuality, including infrastructural and human resource constraints. Having said that, the state government and the department is also making all out efforts to address the various challenges confronting us to ensure the safety of the citizens with the strong support from all sections of the society.
In connection with the COVID-positive patient from Nagaland at Guwahati, he stated that the department has been in touch with the Guwahati Medical College and hospital officials to inquire about his health status. As per the report received from the Superintendent, Guwahati Medical College Hospital, the patient was initially tested positive for COVID-19 on April 12 upon admission to the GMCH. Was tested negative during the second test on April 17. However, the man tested positive again on April 18 and the fourth test is likely to be conducted on 26 April, Yhome informed. He then said that the patient is stable and has been shifted from the ICU to the isolation ward for further observation. His family members were also tested and results came out to be negative.
In connection with the patient from Nagaland who was tested COVID positive at Guwahati, the department has been in touch with the Guwahati Medical College Hospital to inquire about his health status. That the patient was initially tested positive for COVID-19 upon admission to GMCH. The subsequent second test was negative, and the third time he was tested positive again. Presently, the patient is said to be stable and he has been shifted from the ICU to the isolation ward for further observation.
With regards to the surveillance activities in the containment zone in Dimapur, over 5,000 persons have been interviewed covering 909 households as of April 23, 2020, and 382 samples sent from Dimapur district have tested negative.
With regard to the surveillance activities in the containment zone in Dimapur, over 5,000 persons have been interviewed covering 909 households as of 23rd April 2020. So far, all samples, that is 382 samples, sent from the Dimapur district have tested negative.
On the issue raised about the quality of equipments being distributed to the districts, Yhome said that the department cannot afford to risk the lives of healthcare workers.
Issues have been raised on the quality of equipments being distributed to the districts. The department cannot afford to risk the lives of the healthcare workers who are the frontline warriors in this battle against this disease. All the districts have been informed to come to the directorate to choose and select the equipments in stock by themselves.
Yhome also informed that the state government is pressing hard to enable the state to begin testing samples for COVID-19 in Nagaland within 20 days.
The state government is giving full support to the department in the expeditious completion of the biosafety lab, and the department is pressing hard to enable the state to begin testing samples for COVID-19 in Nagaland within 20 days from today.
On the issue of lockdown, he said that the department appreciates the corporations of all the citizens of the state. He also expressed appreciation to the private healthcare units in the state.
The department appreciates the cooperation of all the citizens of the state during this period of the lockdown. These lockdown measures are very crucial as they ensure norms of social distancing and thereby help in breaking the chain of transmission.
Principal Director Dr. Sukre meanwhile explained how the COVID-19 patient had gone to Guwahati to eventually test positive there. He stated that the patient had certain underlying diseases and the doctors thought he had other illness rather than COVID-19 infection and thought appropriate to refer him to Guwahati.
Yes, certain underlying diseases, and that leads to the doctors to think that patient was having other illnesses rather than this COVID infection. So that was the main reason why it was first referred to this Guwahati Medical College. In fact, it was Apollo, to be frank. In the meantime, that the patient himself has already arranged to go to Guwahati. That was the main reason why it has happened like that. So it doesn't mean that Nagaland doctors refuse to take the patient, or it's nothing like that.
Meanwhile, Dr. Yang Thongkikon expressed gratitude to the Assam government for taking good care of the patients from the state.
We are very grateful to Assam government for taking such good care of persons from Nagaland. And in this matter, what we would like to advise is that, issuing statements after statements, countering, it serves no purpose. But what serves the purpose is that they are taking good care of us, our patients, and we are eternally grateful to them.
The status report of Nagaland as of 23rd April 2020, a total of 543 samples out of the 607 sent from Nagaland have been received and all have tested negative. With Inzan Bemukhovong, Kohima.